Hi, everybody, and thank you very much for joining us today. So I'm Richard Milne. I'm Senior Social Scientist in the Society and Ethics, or Ethics and Engagement and Society group at the Wellcome Connecting Science in Cambridge in the UK. And I'm absolutely delighted to introduce today our seminar speaker, so Professor Yali Cong. So Yali is Professor in Bioethics and Dean of the Department of Medical Ethics and Health Law at Peking University Health Science Center. She has a wide range of research interests in research ethics, global public health ethics, and medical professionalism. And over the last couple of years, it's been a real pleasure to collaborate with Yali on the Your DNA, Your Say study of international public perspectives on sharing DNA and health information. So it's really exciting to have Yali to talk to us about comparisons between China and the UK and health data and DNA data. And just if you do have questions for Yali during the seminar, we're using the Q&A function at the bottom of your screen. So just if you drop questions in there, and then we'll collect them afterwards. So Yali, over to you. Thank you.
Thank you, Richard. Let me open my screen. My topic is about the public perspective on genetic information, specifically focus on, is there an essential difference between China and UK? So I select this point because I'm very honored to be involved in the Your DNA, Your Say, this program. Actually, at the very first beginning, I'm not very familiar with this area, but after involving and after reading the papers, even I involved the project, but I really contribute very, very, very little on the paper. But more, I learned a lot from the paper and find there are some difference between China and UK, but I'm also thinking what difference are essential, what difference are not essential, but only because we use a different question or because we have a different understanding for the some questions. So today I focus on these 3 points, rethinking the difference. What difference makes them essential? And we know how can make the biobanking, how make the data sharing, especially for the genetic information, how we can use this data, especially this big data, to help the whole society and to help the medical treatment, to help the more patients, even can help for the healthy people. So I think to promote the trust is very targeting the point to the future. That means to promote the trust on the public, not the patient, not only the other population, but the more important is the public, the general population. So these 3 points I will. And I based on the papers of the project, and also I searched some other literatures. And literature I list here, and some of them I specifically to put in my slides. So this is the papers I read, prepare for this presentation, and all this one, and the 2 Chinese papers. But I also have the English titles here. And this several slides is borrowed from Richard. Richard helped me to prepare some specific slides, especially can tell us the difference between China and UK. And this one is about the between China and UK. Even we both more than half of the survey population, but China, it seems China is more than UK about the think the DNA is different to other types of medical information. So this is one about the cognition issue. And about the transparency, so this I here does matter. That means that is related to the end in my slides. The transparency is one essential, I think. This slide from Richard is measures how people to think which is important to help people to trust the donation to the biobanking and to the genetic research. And here we can see the transparent information. Here is also related one is transparent information about who benefit or who other benefit. I think these two see some consistency. That means this information is really need us to take consideration seriously. That means so UK, they are more confident about the transparent information, but for China, they are not more confident. So for the transparent information about the donation and who will use that, whether it can possibly be misused, all this, I think this slide, I really think we need to think more carefully. And for this, that is the percentage of people who would generally be trusted with DNA and health information. That means for the specific groups, whether you trust more trust their own doctors. And also the other doctors, they also trust, but the more trust on their own doctors. So for the nonprofit and the profit and the government, so we can see it seems China compared to the UK trust more on the company research. But I will relate this in the end of my slide. Is these questions have some specific context. That means in my country, and in my country for nonprofit and in my country for profit. But if we don't ask this question, we don't have international context, but there are some different answers. I will show you in the end of the other research only conducted in Chinese culture. And this, I think, I would like to think this can remind us, because we think trust more on our doctors, trust more on nonprofit, and trust more on government. So that means they remind us who need take responsibility, who should take more responsibility to keep trust. So this is from these slides. And so later, I will use some literatures, and with the aim, I reference this literatures for the several objectives. The first one, I want to show how the rate of the willingness to donate, and not only from our Your DNA You See program, but also can give evidence to support whether the willingness to donate is different from China and the UK. That is one aim. Another one is because there are not very we don't have many literature published in English, but I have found one literature from research in Singapore. And Singapore, there are 80% Chinese. So that literature helped us to know more about the willingness to donate and unwillingness to donate. Also, another aim to use the literature is want to show the time difference. So from early 21st century and around the 2010, and also just very nearly to now, and some data about the percentage of donating rate is different. So that's, I think, from literature we can understand more, not only by our Your DNA You See program, but also you can have some other different background. And this slide I want to, I really like, because this paper this tell us the what's the general points for people to donate. So this actually this is a survey in Swedish, but in the paper it tell us the age and high education, and whether have possibly a positive family history of genetic disorder, whether they believe, I think this is important, whether they believe genetic research will benefit people and related to genetic determinism. So this is very important, but I don't think we address this point very seriously in many papers. So this paper also noticed this, and whether they fear the blood injection, the needles. And also I think it's really very, very important from the literature of Singapore. And many others, they don't address this point very seriously, but I think it's important. And also other concerns for confidentiality, for profit, for business, all this, I think is already very complete to help us, the factors related to our willingness to donate. So this one. And this paper tells us in the Sweden is very high percentage willingness to donate. So I'm not sure whether it's a very correct impression, but I find North Europe is very high, and North Europe is much higher. I'm not very sure whether it can be supported by other literature, but from the literature currently it can tell us. And this is one paper is about literature review, and this literature already take consideration of the China's data. But this China data is only one paper, but this one paper, I compare to other Chinese survey, they have much similar. So I think this literature review can provide us objective perspective. And here it mentions in the UK, almost 35% agree to donate, but in China it was 65. And here is 29 is not unwilling to, and 65 is willing to. So it's something is a different. You can see UK and North Europe is very, very high percentage of willingness to donate, and China much lower. And we can also show some others. This the data from this paper. This paper is just the literature review. They mentioned one Chinese paper is just this one, and this one is mentioned the willingness to donate. You can see the just the middle and the under. The willingness to donate sample was stated by 65. Is already stated in the literature review paper as well. And I think we can see for say this paper was done in May 29, 2010, and this survey is conducted in Shanghai and Shanghai Renji Hospital, and the two groups, one is patients, one is general population, and they can see for the general population is a slightly different with patients, but not very different. Also, it mentions some mistrust on the academic institution. So compared to other literature, it seems this paper don't tell us the Chinese people trust more on academia, but Chinese people trust more on government authority to the use of their information. And this is one I would like to mention is about the Singapore. And you can say the time. So I would remind you need to notice the time of the literature. And this survey in Singapore is done before 2004, is a little earlier. And you can see it's a little less percentage compared to the Shanghai survey just now I show you. So this is about the 49.3% willingness to donate. So this is you need to notice the time. But I would like to address here the reasons for and against donating. Is donating blood for genetic. This is not only donating blood, but the research is donating blood for the genetic research. So the common reasons to support the willingness is a medical advance and the benefit for the future generation, including their own family. So that's very common reasons. These reasons also related to other Chinese survey I will show you just after this. So this, so medical advancement and benefit to society, benefit to family, benefit to themselves is more important and a common reason to support. But the unwillingness to donate blood, we can see from Singapore research. The first one is the fear of pain, fear of blood, and fear of the needles injections. So that's very interesting, and it's different, a little different with other literature. So this we can see from this from paper. And others is about the fear of finding out they have genetic disease and the fear of the discrimination and confidentiality. And also I want to, I didn't see more in the end, but here I will add here, we need to find some difference. What the people concerned, what they feel is sometimes not essential different, but related to the insurance system, related to the working system of the treatment. So for the Singapore, why they support the donate? Because if they give them some free to help them to do free checkup, then they would like to donate their blood for genetic. So I think maybe some barriers to have the medical treatment, barriers for the checkup examination, maybe is a reason to support, but sometimes it's not essential related to the willingness to donate in generally. So that's I think. And this I will tell you is for the people unwilling to donate, but if sensitives were provided, for example, to provide some gift or money to research, maybe this can help them to donate the blood. It's compared to they donate but no self-interest, but and need to suffer the injection, and maybe the incentives can make them balance. That is what we need to show. And Singapore and other Chinese studies show us they believe the genetic research will benefit people, especially they would like to participate the research supporting the government. So that's I think we need to keep notice. But also here in green, it also mentioned because it's done conducted before 2004, and at that time the level of the willingness to donate percentage compared to US and Europe, it mentioned is in Singapore is very lower percentage compared to USA and the North Europe. Here is I add the topic here because from Singapore we can know they have some barrier psychology, fear of pain, fear of blood, and then also if the donate there is no self benefit, though they have benefit to society, but no self benefit, but they will need suffer, then it's really a big reason, big barrier to unwillingness to donate. So this related to us for remind us for the future how we can to support people, how we need to send a message, how we need to move the barriers in order to help people to promote the trust and more willingness to donate sample for the future genetic research. And this literature is I would like mention is it's a very specific research because the general research ask questions is for the donation just generally, but this paper is for specific disease, the MI, the myocardial infarction disease. It's for this specific disease, maybe you can explore some very real reason to donate or real reason to not donate. And for this paper, it mentions the ethnic disparity. And this paper is also, I have read this, and I also noticed these three words, adult, man, and white, represent the representatives in the big data area. So, and that's related to the disparity of resources and related to the unwillingness for the minority. So that's the issue I think is very special point it addressed in the Western, but ethnic factor is really not an issue in Chinese context. So that's one point I think we need to take to address, and I think this point is essential different. And I will very briefly show you two other surveys in Seoul Chinese context, not published in English, but can show us a whole picture of the willingness and unwillingness and the reasons to strengthen the willingness and the reasons to weaken the willingness. So I think these two Chinese paper can help us to understand more and can stand as the whole picture for the Chinese people. I found some other papers related to genetics is more related to genetic testing and the more focused on the disclosure to family member or disclosure to other stakeholders. So we have very few about the donation analyzed. So this two Chinese paper is available. So it's one is the master dissertation. It's a conduction of the survey in Shanghai, and it's a sample of this number. And this number is a general public. Others is for patients, and the willingness to donate is still around 50%. And this conducted in the 2014 and 2015. So this is one. And here is mentioned significantly related to education level. So that means for the education, high education level, they can understand more about the biobank. And among this population, more percentage would like to donate. So I mean, for the lower donating, maybe because more people don't understand what it means of the genetic research and the DNA information. So that is one factor we need to think. And here is what's the factors to strengthen people, the willingness to donate. The first one to get the research back. So that is very important. And they can have a chance to withdraw. And they sign informed consent, and also they need to have some stipend to involve the research. And the the factors, the top three to weaken the willingness to donate. The first one is if the sample be used for profit. So this I would like to corresponding the slides that at the very beginning, the difference between China and UK. It seems China have more percentage than UK to support for profit, but actually that information, that question is asked us to support for profit in your own country. So this is a context we need to consider. So if we don't have this context, I find the people, the first one, the reason, the barrier to the donating the sample, if the sample for profit, that is very willingness to donate. So I think that it's very common. So that means for the profit research, this difference is not essential. So that is the one I would like to think. And if they cannot get back the result, so just very corresponding to the strengthen the factor, the willingness to donate. So that's much where. And if they can don't have the stipend incentive for journal research, they also is awakened to the factors to the willingness to donate. So that's the one. So another Chinese paper is conducted in Beijing. It's in September 2027, and you can think a more percentage of the willingness to donate. And one reason maybe because in the Beijing area, because the population they selected. Another reason might be because it's very near to currently, is because more people understand the biobanking, more people understand what means of the genetic disease. So that's the point I would like to see. And this is one, the reasons to donate is, you can see the several top reasons is can help the promote the medical development to if they donate, they feel the contribution to the society, and also they can be benefit for themselves, their own family, and also several point people say the fourth reason support is possibly help myself to reduce medical costs. Whether it's true or not, but it's one reason for some people to support donate. And this reasons unwilling to donate is the very the big is the information confidentiality disclosure, and also is top reason. Misuse is the second reason. Loss of control to their own sample is the third reason. Be used for profit is the fourth reason. And I think this we can be noted. So here I already mentioned ready back to a comparison between China and UK. So for the higher percentage to support to support the for-profit, I think it's not essential because because of the questions, the social context, and for the donate for the own doctors, for the government support research, I think it's China have higher percentage to trust. So that's one. So last two slides is I just not very mature, but just for the time being, I'm thinking what's the essential difference between China and UK. I think transparent is very, very matter. So this one, and maybe another, I think donation itself is essential. So even China have a lower percentage of donation, but maybe essential point is how we society, the perspective of donation itself. And we need more sociology and anthropology study to show this. Currently, according to my knowledge, donation itself in China is not very strong insensitive. What the strong insensitive is to treat back. That means if I can get help from something, but we would like to retreat back, this is a very normal, is a common sense. But donate to general is not for retreat back to specific people, specific institution. I think that is a different phenomenon, at least for the China. And another one is a lack of trust, trust for the information, how can be used properly. So the misuse is a very big concern for some people. So lack of trust for anyone to properly use the genetic information, I think is a very essential concern in China. So I think this several points essential. Another one, I'm not very mature, but I'm thinking whether how to view genetic research is a matter of essential, because for the Chinese public, they don't think genetic is play so determinant role of their health. They more willing think genetics, their lifestyle and their nutrition and whether to exercise. These several factors coexist to form or to exist to decide their health situation. And the genetic itself does not so matter for their own health. So that might be one reason the support for the donation for the genetic information. So that's not for me, not very confident, but I would like to propose whether this factor is essential. So that is, and from the Singapore research, we can see, so from physical, some feeling, some fear or pain, this is, I think, if they don't take donation, it's so seriously, and the donation itself for the genetic research does not retreat back in directly for their self-interest, plus it's pain, suffer, then I think it's really a big barrier for the general population to donate blood for the research, genetic research. And what's common in the future? So we have some difference from China and other countries, but I think some difference is not essential, only some extent. And also from some difference and from some common sense behind. And this slide, I just very, also not materially for the time being, but I think we should consider for the future how we can help the society to promote the trust of the public to. So misuse is one point, and who can access to public, who can to who the key how the stakeholder can help people, because the people some stakeholders maybe not very essential, but some may be essential for the people, for example, government, and for the hospital. From Chinese survey, we can say these 2 points: hospital, government, and also academic. These 3 factors are key points to access to the public, to help them to form the objectiveness of the importance of genetic research. I think this is one recommendation for the future. And another recommendation for the future, I think we need, when we do analyze from literature, maybe we think from 2, 3 difference of the time point. One is before 2000, just after genetic sequencing is successful. And the second time point is precision medicine is around 2010. And then is 2020, especially for the big data area. I think these 3 points for the time being can help us to analyze the willingness and unwillingness, how to remove the barriers, and also help us to think continuously and to think the data behind that is a time difference. Then can help us to analyze the analyze statistics more objectively. So so that's all I would like to present. So many things are not very material, but this is a very good chance for me, at least for myself, to understand this issue, and especially to think what's the difference are essential between China and UK, and what the key effort need to take in the future, at least for Chinese public to understand and to promote the trust of public to support the genetic research and the donation of their health information. So I would like to stop here. I'm very eager to have more comments and questions.
Thank you so much, Yali. That was fantastic. Yeah, so I just, if anybody does have questions, please put them in the Q&A. If I could start, it was really, really interesting. There was a lot of literature, I think particularly the studies from Singapore and from China that I hadn't seen before. So it was really useful. I was interested. So China has made a very big investment in biobanking and genetics research. And do those studies recruit from the general public, or do they recruit from hospital populations? And do you know if the willingness of people in practice, when those studies recruit, is high? Do those studies find it easy to recruit participants?
Yes, the government, we support a lot for the genetic research, especially I think 3 years ago is for the precision medicine. So precision medicine is a real hot topic, but now it's not so hot. So big data is hot, and the precision is not hot yet now. But at that time, the government supports some studies. I know they have a cohort for so many people. 10 million, how many? Maybe 100 million. You are right, both patients and health people were recruited. But I not yet found the study about the survey about the willingness to donate or so not yet. The Chinese paper, I think this tool is really very targeted to our presentation, but I not yet have searched some others, so not yet. So maybe they are on the progress, but not yet published yet.
Okay, thank you. And I was interested in, I think the idea of looking at different time points is really useful, yeah. And I think it's but
the time point maybe not correct, but I think we need to, this time point help us to analyze the survey data.
Yeah, I think it would be useful to replicate studies that were done 20 years ago to try and look at the same. Yes. So we have one question that's come in, which says, thank you for the presentation. I'm wondering whether the Singapore perspective might be different because regulations around data protection and insurance have changed. So since 2004. So how much do you think you can learn from the Singapore data for China, I suppose? How?
Yeah, this is a very good question. So the Singapore paper is around 2004, and in recent years, I think for the data protection, Singapore have very good regulation, and Singapore is very famous in Asia is for its regulation, and for the strict regulation. But how this data protection related to the willingness or unwillingness from that paper, I cannot say anything of that. And but this question is very good. I think I will notice this. Maybe they have some update about this, but from that paper, we cannot say anything.
Okay, are there any other questions? Yeah. Okay. So here we have one. So thanks, Yali, for the interesting talk. Who, yeah, from somebody who said that they did the survey and found many questions were the first time they thought about those things. So are you aware of the of how the government thinks about genetic research or public engagement in genetics, and whether there are policy plans, government plans, I suppose, to improve the collection of data, of genomic data?
So that I think is just I mentioned in the presentation about China and the UK, what's the difference essential? I think the transparency is essential. That means, of course, government is very eager and want to know the attitude of the public, but still, I think not only the public, but also the genetic researchers, they not yet have strong sense to know the attitude of public. So in theory, they must, I believe, they think the public protection is important, but in practice, not yet, from not many levels, to conduct the very big national survey to collect the information about the public. So I think that's this difference is essential because from the survey we can also see the people don't think the transparency is the important factor to help them to trust that. That means the transparency is still weak point currently now. And well, on the one hand, the government not yet conduct the so big level, national level to collect the information about public attitude. But on the other hand, they didn't do that. They don't think it's a emergency issue. So that's I'm not sure whether my understanding is correct or not, but I still think for the public engagement, I know UK is so famous of that. I really admire this. Public engagement, that means public trust this, then can engage. If public not trust, they will not engage it. So I think the public engagement and the transparency of the information is really essential difference between China and UK. I think in China we have a lot of things to do for this.
It's interesting. I think, yeah. I mean, I could probably keep asking you questions all day, but I just wanted to ask one more, which was around. You said something really interesting when you were talking about the question of trust and trust in companies, in for-profit research and non-profit, and about how the question of who takes responsibility for trust. And I was wondering if you could expand on that. I mean, how do we know who is responsible for trust, and what does it how does it look different?
Yeah, I think the for-profit for always in China from historical, the people don't trust the business. They trust the government. They don't trust the business for profit. So that is still very strong. So that is one survey in Chinese. The first one is if the research is for benefit, because it's a donation, donation, that means you donate to that. And you cannot have the interest directly back, let alone you for profit. So I think from the culture is from tradition, the for profit is really we're not support for profit, let alone it's for a donation context. So I think so that's why I think even China, UK have difference on this point, but I don't think it's true. Because for the Chinese people's survey, they really concern this. They don't want their information be used for profit. So that's one. And so yeah, it is. I expand the thinking to, because the public involvement is a key point for the biobanking, and you have to have the public to support. Then the key issue in the near future is who are the key stakeholders. That means public trust whom, then whom will be the key stakeholders to keep the trust. So that's my logic. I'm not sure whether it's very correct. Then you have more responsibility to release information, to do education, to help the people remove the barriers. If people think the result back is very important, then in the donation process and the running our banking, how can the result be back? Even it's anonymous, but you can have a website to release information about what we have, what achievement we have, then to let the public know.
Yeah. So kind of return of the overall study achievements, or the rather not necessarily individual results, but yeah.
Yes.
I think it's really useful to think about who's got, how different people have or different groups have different responsibilities in terms of building.
Yes, because we both, China, UK, we both trust their own doctors. Their own doctors have more high responsibility. Yeah.
So yeah, there's just one more question that's coming about whether you could say something about people's motivations for trusting their own government, because in the UK that's quite low, whereas in China it's much higher. And whether is that the case across domains? Is it a general kind of level of trust, or is it specifically to do with health?
I think this is a common sense. Trust the government. It's unusual compared to the Western perspective, but I think it's because the working system, the mechanism system of the society from tradition to now, the running system of society is running from central government. So central government have the resources, central government have responsibility. And even the government have done many things, maybe not satisfied, maybe for the bribe, many things. But the point is we don't have other entity to trust. And the government is true in the very, important point. For example, in the infectious disease control for the pandemic, government is play the key effort, and also only it can help the society to run well. So we trust government, we don't trust the for-profit, but for the non-government organization or other institutions, they need to grow to take more responsibility to gain the trust for public. So public is too strong and others need to grow. I think that's the point in China.
That's interesting. Yeah, it's been absolutely fascinating, Yali. I think we've come to the end of the questions, and
I'm worried. Yes, maybe because maybe I didn't express very clearly. Maybe so it's a barrier for audience to understand. That's possible. So
I think you've given people a lot to think about. So I think I thank you so much again, Yali, and
So thank you, Richard,
and and thank you everybody for coming. And I just wanted to flag up as well, we have another seminar in a few weeks, which I've just lost the date for. Lauren or Angela, I don't suppose you could drop that in the chat. But so in a few weeks we have Barbara.
I'm just looking in my calendar to remind myself as well. The 10th of November at 4 p.m.
Okay, so the 10th of November at 4 p.m. UK time, we have Barbara Prainsack and Torsten Voigt talking about public perspectives on DNA and health information from the German arm, if you're doing the same. And so so thank you very, very much again, Yali, and I look forward.
Yeah, my honor.
To seeing you soon. Thank you.
Thank you.